Chapter 12 is the therapeutic environment. So we talked about the therapeutic communication, therapeutic relationship. Now let's talk about the therapeutic environment. In 1953, Maxwell Jones published a small book in England that described the value of the environment as a therapeutic tool. He called this the therapeutic community. Therapeutic environment, also we call milieu, describes certain settings or environments designed to help patients replace inappropriate behaviors with more effective personal and psychosocial skills. Number one is an inpatient service. Okay, inpatient service. Inpatient services are provided for three main groups of people, and I need you guys to remember this, please. One is those who experiences crisis. Okay. All right. Two is for those with acute mental or emotional problems. Acute mental and emotional problems. And then also those with chronic mental illness. Okay. So let's go over it. Those who are experiencing crisis, for example, you have a patient that's actually getting out of control because of the manic episode that they're having. Maybe they become very aggressive, even physically aggressive towards another person. There will be what we call crisis stabilization interventions. This is providing the patient with a place to stay in 1 or 2 day treatment settings. Okay, the goal here is to actually stabilize the patient. Goal here is to actually stabilize the patient. Homeostasis. Okay, so you have 1 to 2 day treatment settings. This is because of the crisis and we're trying to stabilize the patient. The other one is actually when there's an acute mental or emotional problems. There will be an inpatient service that are necessary when people cannot function sufficiently to satisfy their basic needs. Maybe the patient, let's say, for example, has a bipolar and is going through a manic episode and they cannot actually take care of themselves already. They cannot keep up with their medication regimen or take their medication properly. Then they're going to need an inpatient service. Okay. Um, and then those with chronic mental illness, a chronically troubled person may feel that life in the inpatient facility may be better than a lonely existence in the community. Okay. What is an inpatient setting? Inpatient setting are those like locked units for those patients that need to be stabilized. We call them inpatient service. That's why it's called inpatient. All right, another term that we need to remember is recidivism, right here. Please remember this word right here, recidivism. Okay. All right, what is recidivism? This is when there's a repeated inpatient admissions, and we also call this the revolving door syndrome. Why? Because this is like a revolving door. What's gonna happen is that patient is gonna go to the manic episode, or there's gonna be a crisis, and the patient will have to be stabilized. Will go into that 1 to 2 day treatment settings in an inpatient settings, and then the patient will be stabilized, and then they will actually go home after a few days. And when they go to their own home, what's going to happen is the medication or the treatment is going to be depending on the patient or the family member. And if they actually fail to do and monitor what they're supposed to be doing, then the patient is actually going to go back to the crisis stage, and they will actually need another inpatient setting. So that's why it's like a revolving door, and we call it recidivism. This becomes a way of life for many chronically mentally troubled individuals, and it's a frustrating aspect of inpatient mental health care for both clients and care providers. The primary reason for return to the inpatient environment is the client's refusal to take their medication, right? So sometimes we will stabilize a patient and then they will be able to be discharged, go home. And then once they go home, they will be non-compliant. They will actually not take their medication already. Maybe, for example, from a side effect that is going on. And that's the main reason why recidivism happens. Is once they're out there, it's entirely up to them. Most of them is not going to be compliant. They're not going to take their medication, and then they go back to the crisis mode again, and they go back to the ER, and it's like a revolving door. Goals of a therapeutic environment are to provide protection, support, and education. Okay, let's highlight this. Okay, the goal for a therapeutic environment is to provide protection, support, and education. Okay, with the therapeutic environment, the care provider is going to assist the patient in meeting their needs. Clients can learn to replace their maladaptive behaviors with more effective actions. Okay, so around this time or in a therapeutic environment, this is when the care provider is actually learning to assist in what the patient needs, and then the patient now can actually learn to cope and use some other coping mechanisms instead of having that maladaptive behavior. Maslow's hierarchy of needs, if you remember the little pyramid that talks about those physical needs that must be met before higher level actually can be met. So let's go back to that. You have physiologic needs, safety and security, love and belongingness, and then self-esteem needs, self-actualization needs. For physiologic needs, this is the most basic one. Your air, right? Food, hygiene, environment. And these needs need to be met before they can even go to a higher level, like your safety and security, feeling of physical safety and the ability to feel secure with others, love and belongingness when the person needs to be accepted and find one's places within a group, and then your self-esteem needs that you must love and respect yourself before others can love and respect you, and self-actualization need is the need to achieve one's full potential. Okay, variables of the therapeutic environment. Every staff member assists clients with activity of daily living and monitors each step made toward treatment goals. Clients are expected to follow the rules and engage in appropriate effectiveness. Make efforts to support the patient in becoming familiar with the therapeutic environment. And the process of preparing for discharge begins upon admission. Then you have compliance and non-compliance. Those clients that follow their medication regimen, the prescribed treatments, are said to be compliance, and those who do not are called non-compliance. So, genuine concern is a powerful tool in helping patients with compliance. For example, you have a patient that don't want to take their medicine, and you are trying to actually have the therapeutic relationship with the patient. You gotta show some genuine concern, because when the patient feels that you actually genuinely care, then they will actually, or they might actually be more compliant. They would actually feel that care, somebody is actually there caring for their well-being. Now the compliance might actually be better. And that is to wrap up chapter 11.